1.
Do you have a loved one who suffers from memory loss or dementia? According to Medline Plus, memory loss is unusual forgetfulness. Forgetfulness is common as we age. Dementia is a form of memory loss that is not common as we age. It is a syndrome in which there is a deterioration in memory, thinking, behavior, and the ability to perform everyday activities. While dementia mainly affects older people, it is not a normal part of the aging process. Symptoms of dementia include confusion, concentration and memory problems, declined critical thinking skills, agitation, restlessness, unsteady gait, depression, apathy, forgetfulness, and needing help with personal care. The most common form of dementia is Alzheimer's, but this presentation is on two other forms of dementia: chronic kidney disease dementia and vascular dementia. Chronic kidney disease dementia is a long-standing disease of the kidneys which will result in kidney failure. There are two main causes: diabetes and high blood pressure. Symptoms of chronic kidney failure come on slowly, and by the time the symptoms are present, there's too much damage to the kidneys already done. Diagnosis occurs through regular checkups and blood work. Monitoring the changes is also done through blood work. Vascular dementia occurs when the brain is damaged because there is no blood supply to the brain, or low blood supply to the brain. Causes include stroke and narrowed chronically damaged blood vessels. I have personal experiences with both of these. My great-grandmother had high blood pressure, which led to dementia and eventually kidney failure. She was born in 1920 and grew up in the Great Depression. Regular doctor's visits were not a common thing back then. They were raised to go to the doctor only when they were sick. She was in her mid-80s before getting the diagnosis that she had kidney disease. Subsequently, she also had dementia. She lived 6 years after that diagnosis. One of her symptoms included time frame confusion. As an example, she often drifted back to earlier times of her life. One of her most common requests was to go home. This request came while she was at home, but she meant her child at home. She had lived in her adult home for over 40 years. She also frequently confused family members. She thought her daughter was her sister, she thought her granddaughter was her daughter, and she had a baby doll that she thought was her granddaughter. My grandfather had heart disease, which led to vascular dementia. His symptoms included a sharp decline of critical thinking. As an example, my grandfather was a carpenter by trade. Dementia caused him to forget common carpentry tasks, like finding studs in walls, measuring to hang a picture, using power tools such as a drill or a screwdriver. We also saw a decline in his ability of words and ability to convey a complete thought. He would have trouble remembering what words he would like to use, and it would take him a long time to complete a sentence. My grandfather also experienced restlessness. He could not find a comfortable position to sit, lay, stand, or sleep for extended periods of time. He was up and down all night long, which made it even harder on my grandmother. I also had personal experience with dementia through my job. I am a certified nursing assistant at a rehab facility, and I work with patients who are aggressive, emotional, confused, and need help with everyday tasks such as hygiene, eating, and walking. There is no cure for dementia or to slow its progression. New treatments are being tested right now, and some have been put into clinical trial. Care plans include early diagnosis, maintaining physical health, cognition, activity, and well-being. It also includes managing physical illnesses and symptoms, like detecting challenging behaviors and psychological symptoms, and providing long-term support to caregivers. In conclusion, forgetfulness is a common symptom of aging. Dementia is not forgetfulness. There are multiple types of dementia, but we address chronic kidney failure dementia and vascular dementia. There's a long list of symptoms associated with dementia, but they vary from person to person. There's no cure for dementia or to slow the progression of the syndrome. Through personal experience in my family, and my job, I have found that dementia is overwhelming. There are physical, emotional, and financial pressures regardless of caring for the patient at home or through a care facility. Both my grandmother and my grandfather were cared for at home. Caring for someone with dementia, whether at home or in an assisted living facility, is a labor of love. Now I'd like to introduce my audience: my father Matt, my mother Natasha, and my brother Kyle.